All right. Hi, everyone. I'm up in Flagstaff, Arizona. It is very windy and snowy here. We went skiing with my family, and I am just thrilled that I made it back in time to join my friend, Dr. Paul Lynch. We're talking about opioids and sleep tonight. And Dr. Lynch is the founder of Arizona Pain. He's been part of my care over the last couple years, really. And, there's so many of us out there that have just been handed out opioids over the years. So I can't wait for you to teach us about how these affect our sleep and what our options are. So welcome, Dr. Lynch, and welcome everybody on the webinar. If you guys have a question during Dr. Lynch's presentation, please put it in the chat or the Q&A. And then as soon as Dr. Lynch is done, we'll take a few questions and then we'll let him get on with his evening, and you guys as well. So thank you, Dr. Lynch.
Thank you, Lori. It's nice to see you again, as usual. I appreciate you giving me the opportunity to teach some of your patients and some of my patients. The more we've got to know each other, I think we both have a passion for education and for helping people, and we both have a passion for sleep apnea. And so with that as kind of a segue, I think I will share my screen and I will pull up this lecture. And I'm going to just jump into this. Just so everyone knows, this is going to be kind of a short one tonight. So hang in there with me. I'm going to give you like 10 slides, 10 to 15 minutes of teaching, and then we're going to take questions for 10 or 15 minutes, and then we're done. But in this very short amount of time, I hope that I grab your attention about how important sleep apnea is. Lori knows this because this is what she does full time, and many of you know her story, and she's passionate about saving lives. I'm passionate about saving lives also through the opioid epidemic. And what's crazy is opioids and sleep apnea intersect in this lecture tonight, where the thing that I've been managing for many, many years, which is opioids and the downstream effects of those, actually causes more sleep apnea and more deaths from sleep apnea as well. So that's what I'm going to talk about. Most people don't know that I'm going to go back actually. Sleep apnea kills about 40,000 people a year. That's more than all the people that die in car accidents across the entire United States. 40,000 people die every year from sleep apnea. And how do they die? Well, some of them just stop breathing in the middle of the night and don't wake up. But some of them die from stroke or from heart attacks. And that's what's really crazy is if you have sleep apnea, you increase your chance of death from coronary artery disease by like 40%. You also increase your chance of having a stroke by 2 to 3 times. And so tonight I'm going to talk a little bit about the intersection between sleep apnea and opioids. So while opioids can be a beneficial element of chronic pain treatment plan, they can also exacerbate sleep issues. What I mean by that is, we've been talking about opioids for many, many years, but the reality is most of the patients that come through our clinic now that are on opioids, we're actually finding that we're helping them with the opioids. We're using much smaller doses than we used to, and we're being more selective with who we're using. The bigger issue with all the deaths nationwide is illicit use of opioids on the street. So last year there were 100,000 people that died from drugs in general, and about 2/3 of those were opioids. And during COVID, that number just kind of exploded. It went from like 50,000 to 60,000 to 80,000 to 100,000 dead from drugs last year. But most of that's not happening in pain clinics anymore. It's not happening to my patients that we're managing because we're managing a lot smarter. But we do still have some risk. And one of the biggest risks is when a patient has sleep apnea and they're taking opioids at the same time. And so opioids have been shown to reduce sleep time. They've been shown to decrease your overall sleep efficiency. And this is the big one. They've shown to reduce respiratory drive. Studies have indicated that up to 75% of patients in a pain clinic who are on chronic long-term opioid therapy may suffer from sleep apnea. So even though we're getting better at addressing things like addiction and really big doses of opioids, even if they're on the right dose, it might be causing sleep apnea, which then can cause issues with their heart. And when I say might be, it's important for pain doctors and pain clinics around the country to recognize the interplay between opioids and sleep apnea and to actually start screening for this. So we started screening for sleep apnea in my clinics about 4 years ago. I believe this is going to become the standard of care over the next decade, but it's not today. And so I'm trying to get my colleagues in the pain community to look at this issue and to start screening for sleep apnea. There's actually very simple screens that you can do. If any of my friends join this, by the way, I've got a bunch of pain doc friends around the country, and I'm going to share this too. And you want an easy, simple measure or screen, reach out to me and I'll send you just a very quick screen where you can find out if your patients are suffering with sleep apnea. So what is sleep apnea? It's pauses in breathing or periods of shallow breathing during sleep. There's two types of sleep apnea. One is obstructive sleep apnea, which causes a mechanical blockage in the airway. The easiest way to think about it is you lay down and your tissues kind of collapse. And when you go to take a breath, you can't because the tissues are blocking your airway. I'm an anesthesiologist. So for me, we understand this. Excuse me. We understand this in the operating room. If we start to give people medicine, sometimes they just stop breathing, but they obstruct first. So that's kind of like, replicating obstructive sleep apnea. OSA, or obstructive sleep apnea, is the most common type of sleep apnea. It occurs 90% of the time. The second most common sleep apnea is central sleep apnea. And it's caused by irregular brain function, and it's associated with loss of respiratory drive. It's a little bit more complicated version where your brain just shuts off. Amazingly, opioids have been shown to exacerbate both forms of sleep apnea. And so it's super important for pain doctors around the country and for pain patients around the country. If you're taking opioids, you should be aware, do you or do you not have sleep apnea? And it's super easy to get tested. Matter of fact, we've been testing patients at home. We can send them home with a device that checks them in their own house to see if they have sleep apnea. Usually that's a pretty good screen. And then sometimes if we want more information, we'll bring them into a fancy center and do a more complex test. But a lot of times we'll just do the initial screen in their own home, which is pretty cool. So obstructive sleep apnea, let's talk about it a little bit more. This is a normal airway on the left. It shows how air is kind of flowing in and down the trachea. If you have things like excessive weight, you're a little bit older, you have high blood pressure, you're a smoker, you have diabetes, male, gender, if you have a family history of sleep apnea, or if you're on opioids, then you may progress to this second picture, which is obstructive sleep apnea. And you can see it's a little bit hard to tell in the picture, but where it turns red there, that's showing occlusion of the airway and a lack of airflow. And so when you have a lack of airflow, then your oxygen drops, your saturation drops, and it hurts your heart and your brain and your kidneys and a bunch of other stuff. Me and Lori were just talking, going through this COVID epidemic. One of the nice things is everyone now understands what oxygen saturation is. Anyone who got COVID, one of the first things they do is they buy these little things and put it on their finger and just kind of follow their oxygen saturation. We do the same thing when we test you at night for sleep apnea. We put one of those devices on your finger and we tell basically what's happening with your oxygen as you sleep. Central sleep apnea is also a risk from opioids. And this is risk factors for central sleep apnea include advanced age, male gender, heart disorders, including atrial fibrillation or congestive heart failure, and a history of stroke or brain tumor can all put you at risk for CSA. But what we found in the literature is opioids can also reduce your central respiratory drive. So it basically reduces your brain's sensing that you need to breathe. Opioids and sleep apnea. Opioids cause a decrease in respiratory drive, which can result in central sleep apnea. Opioids can also cause obstructive sleep apnea by relaxing the tissues and muscles that support the airway. And just want to make it clear that the majority of opioid-related deaths are caused by respiratory depression. That's why you die. So if you hear that someone overdosed, what happens is they stop breathing. And when they stop breathing, then eventually their heart will stop. But the initial thing that happens from opioids is you stop breathing. Same thing that happens with sleep apnea, you stop breathing. The use of other sedating medications in conjunction with opioids can further increase the risk of respiratory depression and sleep apnea. So I want to make this really clear. It's not just the opioids. Any drug, which is a central nervous system depressant, can make your sleep apnea worse. So some of those drugs include benzodiazepines, Lyrica, and Neurontin. It says here that 16% of opioid overdose deaths involved benzodiazepines in 2019. That number was actually 30% back in 2013. How do we reduce it from 30 to 16? Because the CDC put out lots of guidance to doctors, and we understood that when you mix an opioid and a benzo, that people are more likely to die. So we got much better at not having patients on opioids and benzos, but at the same time, people dying on the street who had opioid use disorder and were abusing medications like fentanyl, or not medications, but illicit drugs like fentanyl, kept dying. So now our percentage of deaths mixed with benzos has come down to 16, which is good. That means that doctors are learning and changing their behavior. But I just want to be clear, anything that kind of depresses your sensorium is one way to say it. Neurontin, Lyrica, Cymbalta, benzos, a muscle relaxant, a sleeping pill, any of that mixed with an opioid will make the sleep apnea issue that I'm talking about even worse. Let's talk a little bit more about sleep apnea. What are some of the associated risks? Well, if you have sleep apnea, you can think of hearts. It hurts hearts. So you'll have heart failure, elevated blood pressure. You can have atrial fibrillation, resistant hypertension, type 2 diabetes, and even stroke. All of these things have been mathematically linked to sleep apnea, where sleep apnea is actually the cause. In some of these scenarios, it's a cause and an effect, but I'm not going to get too much in that today. So just remember heart failure, blood pressure, AFib, resistant hypertension, type 2 diabetes, and stroke all can be caused by sleep apnea. This is one of the tests that we use in our clinic. Are you snoring? Are you tired? Has someone observed you to stop breathing? Do you have an increase in blood pressure? Do you have an increase in body mass? Is your age older than 50? Do you have a large neck size? And are you a male? All of these things would put you at risk at sleep apnea. And so I recommend any of my pain colleagues that happen to be watching this video, if someone tests high on this test, it's called the Stop Bang questionnaire. I can send you a copy of it. If you test high on this test, then you should be screened for sleep apnea. And that's what we've been doing in our clinic. And we found a lot of people that had sleep apnea, they had no idea. We feel like we've saved a lot of lives with this. It's been about 4 years now that I've been doing this in my clinics. So we've been talking about opioids might make sleep apnea worse, and benzos might make sleep apnea worse, and Lyrica might make it worse. Well, then what do you do if you're suffering with chronic pain? Well, I just want to show you, this is going to be the last thing that I finish with. I have what I call my 5-step approach to comprehensive care. This is what we do at Arizona Pain. And I think all 5, that hand looks just like mine, by the way. I'm kind of impressed. Looks like mine. So all 5 steps are important. So I call it diagnosis. It's important to understand what your diagnosis is. Medications, we call these low risk medications. Procedures, minimally invasive procedures that can take away your pain. Hands-on therapy like physical therapy or chiropractic care, and even other. In the past, I used to call other behavioral health, but it made some people nervous to say they need a behavioral health therapist. So I say other now. There's nothing wrong with going to behavioral health therapists. Over 50% of patients that are suffering with pain also have significant behavioral health issues, including depression, anxiety. It sucks to be in pain all the time. And so what we've acknowledged in our clinic is if you're suffering in pain, I think it's great just to have someone to talk to about that. And so that's my 5 steps. One step that I want to talk about that Lori asked me to talk about is step 2. If you look at it, we have holistic pain on there. And this is something we did with our clinics this year where we rolled out a natural supplement. It's actually a very high dose of CBD, but we don't do it from marijuana or hemp. We actually make the CBD from orange peels. It sounds crazy. We're giving people oranges to take away their pain, but we found out that we can make the pure CBD molecule that helps with all sorts of health conditions. We were able to make that from orange peels. And so we brought it to our patients this year, and patients have loved it. We've got to the point where we say, start with this, and then we'll decide if you need one of these other molecules. And a lot of patients just do holistic pain. It's a natural treatment. It's non-addictive, and it's worked. So Lori, I think you've been taking it. Would you let us know how has it helped you?
Okay, so I have suffered for years with degenerative disc disease. I've had 2 back surgeries where they replaced 2 discs and fused like L4 down to S1, L4, L5, 2 different surgeries, L5, S1. And I continued to have this just really strange pain down my left leg. We couldn't figure out, is it from my back? Is it neuropathy from all the chemotherapy? Because I'm also a breast cancer survivor. So it was just this. So I came to Arizona Pain, and your providers were amazing. And, we were trying to figure out, should I do like a stimulator thing in my back to help with that leg pain? And so when you came, I knew you were coming out with this, and I was just like, I want to try that because I don't want to have another surgery. And so, Susan, that works for you, is a friend of mine. And so I finally was able to order my holistic pain CBD remedy, and I have been on it, I want to say 6 months. Does that sound right? If it's been out that long?
Right. Yeah, 5 maybe.
Yeah. So no pain down my leg, like completely gone.
That's amazing.
Nothing has worked. Nothing. I've tried everything, and it took, once in a great while, like maybe tonight, because I went skiing today.
Or when you hit your toe, maybe.
Oh, when I hit my toe. Oh yeah, I dropped. I was just telling him before we started, talk about pain. I dropped the big giant thing on my toe. Yeah. So this has been really great for me. So if you guys are interested in that, Dr. Lynch, how do we reach out to someone?
Yeah, thank you. You can just go on holisticpain.com. So it's just holisticpain.com. And you can order it. And we've been using it with our patients and having great success. I appreciate you saying that. That's what gets me excited is we're talking about these medications that could exacerbate, sleep apnea or make you stop breathing. And whenever we can have like a natural treatment that works well with, very minimal side effects, that's what I start with. For years, we've had a naturopathic physician work with us at Arizona Pain, and we just believe in that, like natural approaches to pain, getting in shape, exercising, physical therapy, and then natural treatments like holistic pain. So thanks for giving us your feedback.
Sure.
I think that's actually my final slide. I'll leave it on the hand because I'm kind of proud of that hand. It looks like mine.
It's really great. And while we're waiting for anybody who has a question to come in, if you think you have sleep apnea and you just don't even want to leave your house and you don't want to deal with your insurance, it is all covered by insurance, but you can come to Valley Sleep, actually not come to Valley Sleep Center. You can reach out to me. You guys are all going to have my email after this webinar, and you can get a virtual consult with a sleep doctor, a watch pat disposable home sleep test that you just wear on your wrist like a watch, and the oximeter. Mailed to you at your house. You wear it with an app on your phone, you throw it away when you're done, and then you have a follow-up. You can get all three of those for $500 if you don't want to deal with insurance, which is like, just, I want to see if I have sleep apnea,
So smart.
So easy. And that is all covered by insurance too, if you want to go through your insurance. So reach out to me if you guys know anybody, but yeah, don't ignore it. Like, don't wait till you have all those hearts, the HEARTS that he put up on the screen. It's because there's so many people, it's like too late. And I can't even tell you how many people get referred to us 10 years ago, 5 years ago, and then they have a cardiac event or a stroke. Or they fall asleep driving and hurt someone. Like, don't wait that long. Just get it fixed. There's so many options too. It's not just CPAP. There's oral appliances. Dr. Lynch's wife can make you a great oral appliance. You could try Inspire, which is what I use to treat my sleep apnea, which is a surgery, but I had severe sleep apnea, which is crazy. Because
I'm going to interrupt for 1 second because I want to tell you about our patients we've sent. There's a couple people in the chat here. If you have questions, just hit the chat button and start to type them in there. And we're going to answer any questions you have about sleep apnea, how to get tested, or how pain management and opioids interact with sleep apnea. But we'll take any questions you have. But I just want to say, from our perspective, like, Lori, you and I have saved like lives together. Like, I can think of 10 or 15 people that we legitimately saved their life. Right. And so we send a lot of patients to you guys because you're the best in the Valley for sure. We'll have a patient, we'll like screen them and find out on the stop, bang, they're checking all the boxes. And we talk to them and they say, yeah, my wife said for years that I just stopped breathing in the middle of the night. And a lot of people just don't understand that is a major health concern. And so we sent some people over to you and found out that they were dropping to their saturations into the 60s at night. Into the 60s.
Yeah.
And you got them treated with some equipment and treating their sleep apnea at home. And then they said that they felt completely different. They got back to normal. You know what happened? A lot of times that their pain control got better, like their pain syndrome got better because they were sleeping better at night. And oh my gosh, just having a good night's sleep, it changes people's lives. So thank you so much for what you guys do.
You're welcome. It ties into inflammation, right? So if your brain isn't, plugged in and restoring all night because it's being interrupted by that snoring and that stopping breathing,
that's right,
and your body will have these inflammation factors go up, and then that's why your pain is worse.
That's right.
No questions.
I don't see any questions tonight. Do you have any questions for me, Lori? And we'll give them a couple more minutes and then we'll finish if we don't have any questions.
I think that if someone's watching and they are using opioids, like, is their first appointment like to come see you? Like, are you someone that could help them find a way to maybe decrease the usage of those? Or
yeah, so one of my biggest goals, it's really been interesting. When I first started, doctors were writing way too many opioids, and frankly, we're killing people with opioids, and we were writing really, really, really big doses. Over the last 15 years of my career, doctors have got a lot smarter and we've reduced the doses. And so we can use opioids as a technique. But that being said, most patients don't want to be on these pills. And when they come to me, one of their biggest goals is I want to get off pills and I want to just get back to where I can live my life. I have patients that have come to me and they have to walk around with all these pill counters and they have to take pills 3-4 times a day. And so always one of my goals is to get them off their meds. And one of the ways we do that is with those 5 steps that I show. We get them into a weight loss program. We get them on the right diet. We might screen them for sleep apnea and help them sleep better. We might send them to our chiropractor and do things like acupuncture. We might start them on the holistic pain product. So we have this approach where a natural and very organic approach to get them back to living life. And you know what happens naturally is they get off the pills.
Yeah. So someone's asking if they're already on CPAP and they're using opioids. Are they safe, or would you still be concerned?
You're never fully safe. That's not the right word. You're safer for sure. If you have sleep apnea, it's important to get on CPAP, but these machines turn off. Lori, you probably know this. People take them off in the middle of the night. They don't put them on. They go to the bathroom. They forget to put it back on. The most important thing is once you have a CPAP device is to make sure you're compliant and you're actually using it all night long. What most people don't know, this is crazy. Lori knows this, but most people don't know it, is your most likely time to die of sleep apnea is about 5 or 6 in the morning, right before you wake up. Yeah, and so what happens is it's in the it's like darkest before the dawn, right? And it's complex, but you get into the deepest times of sleep. And so what happens is, especially with men, is they'll wake up at like 3 or 4 in the morning to go to the bathroom. They come back, they don't put it on, and then they die, and it's terrible. So I wouldn't say that you don't need to be worried, but I would say be very compliant with your treatment. Would you say that any differently, Lori?
No, I think it's important to know too that opioids, from when I was working as a sleep tech, if I saw patients on opioids, they would have increasingly more central sleep apneas.
Yeah. So yeah, just
I think the goal.
So let me follow up on that to make sure everyone understands. What she's saying is the opioids will make you stop breathing even if you open your airway with CPAP, and that's true. And so the data that I presented today showed that only about 10% of the sleep apnea was from that. But in the opioid space, I don't have the exact number, but Lori's suggesting it's even higher. Maybe a third of the sleep apnea is central. So no, you're not fully connected. Thank you for adding that in. That's a really good point.
All right, here's another one. Many of us are a polypharmacy situation to manage health problems. Lyrica, Zoloft, amitriptyline, and so on. Is there a good strategy to follow to minimize the risk? For example, no meds after dinner.
That's a great question. So picture a patient that's on 3. So I like to count up how many mind-altering substances you are on. And my goal is that it's not more than 2 or 3. And so if you're on multiple mind-altering substances, one of the number one things that I would just say is get screened for sleep apnea. So take the Stop Bang questionnaire. Anyone can actually Google this and look it up themselves. But anyone that wants to reach out to me, I'll send you a copy. Stop Bang. And see if you're a candidate or if you may have sleep apnea. Then you can get tested either at home or in a fancy lab. If you have sleep apnea and you treat it, it's going to reduce your risk significantly. Beyond that, I would say try to get your number of mind-altering substances as low as possible, and then try to spread out your doses throughout the day. Your point is great. I have some patients would tell me, oh, they take a handful of pills right before they go to bed. And that's a really bad thing from a sleep apnea perspective, from an overdose and a risk perspective. It's a wonderful question. Thank you very much.
Yeah, thank you. All right. You're always such a wealth of information. Thank you so much. We have to let him go and say goodbye. And if you guys have any other questions, just please reach out to me. If you want to be connected with Dr. Lynch, I can help you as well. So thank you everyone for joining. Thank you, Dr. Lynch. Thank you, Arizona Pain, for helping me make this happen.
Thank you, Lori. God bless you guys. Have a wonderful night.
Bye-bye.
Okay, bye-bye.